Hi, good afternoon, everyone, and welcome to the charities, the mentorings
Sorry,
Zoom.
1 second, Sujata. Yeah, done.
Hi, good afternoon. Today is 13th of July, 2022, and thank you for joining the session on monkeypox. This session is being organized by The Mentor Ring, a charity that supports vulnerable people through mentoring in the areas of education, employment, health, and community engagement. And welcome again, and thank you for joining in today. Those who do not know, this is one of the series on health information. The purpose of today's session is to provide some education regarding monkeypox. UK has seen unusual cases of monkeypox, which is normally spread by infected wild animals in Africa. So what is this disease? How does it spread, and can it be treated? You will know more about it through our very own Rupesh Kumar, information analyst, Public Health Wales, today to deliver a workshop on current misinformation around monkeypox. Please send any questions or anything you have in the chat. Over to you, Rupesh.
Thanks, Sujata. It's my pleasure to be here, and thanks for the opportunity, by the way. I know you all have been busy. So this won't be a formal lecture kind of thing. I just wanted to have a kind of two-way communication session. So I made this presentation very simple. Let me share my screen first. Can you see the presentation?
No.
Okay.
No.
Yeah. Can you see now?
Yes.
With the slide notes, it's like, are you seeing the slideshow or with some notes?
Along with notes.
Yeah, that's a problem. Yeah. Give me a moment.
Talking about, I'll engage the audience. What we do normally is we try to engage the beneficiaries by inviting them to our coffee morning sessions, wherein they meet other people and share their concerns. And then we try to engage, train other people who'd like to be mentors, and we link them on a one-to-one basis. We also have many mentoring activities, like, for example, IT skills, podiatry training, yoga classes, healthy eating sessions, wherein people come and engage themselves and come out with their concerns and talk to them without any hesitations. Let me know when you're ready, Rupesh.
Yes, can you see the slideshow?
No, I can't. We can't. Maybe you'll have to stop and then start again. Stop sharing this. Yes, and then start again.
I'm using Zoom in the browser. That's the issue. Otherwise,
it's all right.
Yeah.
If you want me to, you can send the presentation to me and then I can do it. It's up to you.
Okay, then I will just email it to you.
It's up to you. You're going to email, is it?
Yes, I will share an email quickly. Just a moment.
Shall we do the polls then? Or you don't want to do the polls now?
Yeah, you can do the polls now.
Yeah,
Thanks for
Sangeeta, do you want to do before we can engage the audience by doing polls now, Sangeeta, before this session?
Oh, yeah, I'll launch it.
All of you, if you can do these polls, we're just checking how many of you know about, if you can do that. The first question is, do you share health-related information on social media or instant messengers without verifying the authenticity? A simple answer, yes or no. I can't do it because I'm a host. The second question is, have you heard of the term infodemic? Yes or no? The third question is, how often you'll find inaccurate information on social media or instant messenger? Okay. Have you all done? We got with 100%, Sangeeta? Yeah. Have you done? Ruby and Dolly, everybody has done? Any
I
problems?
finished.
Yeah, thanks. So I shared the presentation.
Okay.
Yeah,
I don't
you
know.
can share on.
Can you see the before the session polls?
I'm sharing the
Yes.
results.
Can you see that, Rupesh?
Yes, I can see. Okay, so research information. Okay, fine. Good thing. Most of us does not aware of the infodemic. Quite often they come across. Okay, thanks. Okay,
We can stop sharing now, Sangeeta. Thank you.
yes. You can share the slides.
Did you send the email?
Yes, I have shared the email.
Yeah.
Okay, fine. My sincere apologies for this technical glitch. It usually happens whenever we schedule a online presentation and it says we are too much rely on the technology. But good afternoon, everyone. I'm Dr. Rupesh Kumar. I have been working as an information analyst in Public Health Wales for almost an year. So I will talk about information and misinformation on monkeypox and other communicable diseases. So as I mentioned earlier, we can have this session as a kind of discussion session rather than a one-way. So the outline of the presentation would be like we have just completed the polls. So I will be talking about infodemics and its concerns and its impact on the society, how to verify the authenticity of the information. I'm going to give some tips, simple tips to follow the to to easily identify the authenticity of the information. Afterwards, we'll be discussing about monkeypox and frequently asked questions about monkeypox, followed by post-session polls and question and answer sessions. So, what is infodemic? The term infodemic may be new to many of us here. So we call epidemic an outbreak, also known as epidemic. In that way, the pandemic coined a new term called infodemic, which actually means the overflow of information from the varying sources across the digital platform. It can be in your physical environment, especially in an acute health event. It constitutes concerns of the individuals, narratives of the non-experts, rumors spreading in the society, and unintentionally created falsehoods and deliberately engineered falsehoods as well. So this false information plays a vital role, in, and it actually enables the individual to adopt a new behaviors as well. A study conducted by one of the popular universities in the UK reported that at least 58%, that is almost half of the UK social media users, saw an inaccurate news on social media, and almost 43% who shared some information were willing to say that some of the news they shared was either false or exaggerated information. I hope like almost every one of us would have come across some false or exaggerated information at least once during this pandemic. So personally, I have encountered a lot of such false information. So the point why I want to focus the social media is nowadays people spending their lot of time in the social media rather than watching the TV. So the information in the social media is easily reachable. That's why even the government across the world are concentrating on the social media to reach the public directly. So almost all the agencies have the Twitter handle and Facebook pages, etc. So why we are concerned about the infodemics? Actually, yes, it's a real concern because the rumor spreads faster than the virus, and also it has a direct impact on health-related outcomes and potentially creates new problems. Um, the what happens the individual, if he understands the misinformation and believe that it's a true, and he uh, there is a tendency to adopt towards a new behavior. For example, it can be a steam inhalation, it can be a oil pulling, whatever. So the uh, um, and also it can lead to a stigma in the community. It causes mistrust in the health system, public health authorities, science, and interventions such as vaccines and newer therapeutics. During the COVID-19 pandemic, we would have come across some unscientific information in the social media, including the steam inhalation, which I quoted before, and also there were some theories about alcohol sanitizers to protect from COVID. Even a few world leaders played a vital role in spreading the false information, including the President of United States of America, which he said about the alcohol sanitizer usage, which could potentially prevent from COVID-19. Here are some examples of the direct impact of health due to infodemic in a real world setting. What happened in Iran? Almost 700 died due to methanol overdose. They assume methanol alcohol uh, can cure COVID-19. Due to the toxicity, almost 700 died. So this is an example for adapting a newer behavior after reading the false information. So in Madagascar, the president of Madagascar introduced a herbal tonic to combat COVID-19. He even demonstrated it by drinking in front of the media, so he gained the confidence of the general public. So what happened afterwards? The public failed to follow the COVID appropriate behaviors such as social distancing and face mask wearing. So the herbal tonic failed to halt the COVID-19 spike. It actually overburdened the health system, which led to lot of deaths. So in this way, misinformation have a direct impact on the health system. Besides these direct impacts on the health system, there are some conspiracy theories circulating around any health event. The most common one is, hello, can you hear me?
Yes, sir.
Yes.
Yes. So it's like I just realized I forgot to say to okay. Thanks for that. We are on the correct slide. Thanks. Because I am on the different screen. That's what. Okay. So this is the most common conspiracy theory about COVID-19. They associated the 5G network expansion with the COVID-19. So this may sound weird, but just see how the people develops the conspiracy theory around a health-related event. Recently, I have come across a conspiracy theories about monkeypox as well. There is an article published in the Medium about the 5 bizarre monkeypox conspiracy theory, which actually are debunked with some facts. The article on the left, actually, it's a legacy article from the Times, which says uh, evidence between smallpox vaccines and the actual AIDS epidemic, which caused in 1980s, in the late 1980s. So after 35 years, the Times published a note saying that the, 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 there is no link between the AIDS epidemic and the cessation of smallpox vaccine. So in that way, nowadays, people have some awareness about infodemics, and they are very curious to know what sort of information is true and what sort of information is false. So these are just examples of conspiracy theory which I come across. Uh, we will discuss the conspiracy theory which you have come across after these presentations. Can you go to the next slide, please? Yes. So I was so curious to know how this infodemic spreads. So what I did, I just Googled it. I found this beautiful presentation in one of the WHO module. So on an average, an individual shares the information to 3 people. Okay, and exponentially it goes to 3 into 3 into 3. So in that way, let's assume I am in the left corner, shares a health related information to 3 of my friends. Out of 3, 2 shared the information to 3 each without checking the facts. One wise fellow considered this as a rumor and didn't spread the information further. So in that way, you can see the right end of the image, a vast majority of the population were not provided with the false information, at least. So the point I would like to say, everyone plays a equal responsibility in preventing the false information to reach the general public. It could save the life of the many. Can we go to the next slide, please? Yes. So here there are tips to uh, easy tips to how to navigate the infodemic if you come across. So in general, all the information should have the source of information and the author and affiliation of the author, the date which was published, and some supporting statements or facts about the topic of interest. First, simply you can just assess the source of the article just by saying which organization published the article. It doesn't matter who shares the information. It can be a family member or a friend or from the spouse even. Better to check the source of the information just by Googling it. Sometimes these headlines are intentionally fabricated to create sensationals. So if you read beyond the headlines, you may find that the headlines and the content of the article may not be related at all. So very few of us go read the article beyond the headline. So I have had a couple of conversations with friends. Even they told that they read the headlines, either they simply swap or they share if they found the headlines is attractive. So we should develop the habit of reading the news beyond the headlines. As is as I mentioned before, any information should carry an author and this affiliation. You can check the author's credibility just by Googling it. Nowadays, it's very simple. If you Google an author, for example, if you Goo- Google a professor name along with the affiliation, you can check whether uh, he's originally related to the organization or not. In that way, you can check the credibility of the information. I have come across an information which is actually related to Spanish flu during COVID-19 pandemic. So actually, it may or may not be relevant to the certain context, present context, but it's an outdated information. So always check the date and the supporting facts, whether the both are related or not. So the next approach is the most important approach. Check the information, approach the information without any bias. So if I am in favor of some information, we always approach the information with some bias. So this is the best way to approach some information. For example, especially the anti-vax, they always approach the information with some bias in their mind. And the last tip is approach the fact checkers. So at the individual capacity, it's not possible to approach the fact checking organization because they charge us. So what I can suggest, these fact checking organization have some blogs and social media handles, and they debunk the misinformation then and there. Even some of the mass media websites, they have linked with the fact checking organization, and they select the trending rumors, and they debunk they debunk the misinformation being circulated. So these are the simple ways to check whether the information what we have received is reliable information or not. Actually, this is very simple step and easy to follow. Next slide, please. You can now ask what are the reliable source of information, because we can list all the unreliable source of information. To make it short, all the official websites of the national public health agencies are reliable. For instance, like Public Health Wales, UKHSA, European Centers for Disease Prevention and Control, Centers for Disease Control and Prevention, Atlanta, World Health Organizations, and these websites publishes evidence-based information then and there. Next slide, please. So this is our first session. So next we are going to see monkeypox, myths and facts. Next slide. So as per the situation report of July 18, there were 1,552 cases of monkeypox reported in the UK, which includes 18 cases from the Wales. Next slide, please. So the most common symptoms of monkeypox are fever and rash. Along with that, we can also expect headache, backache or body pain, chills and malaise, exhaustion, etc. So the swollen lymph nodes are a pathognomic feature in the monkeypox, which cannot be found in any other diseases. I mean, chickenpox and measles. So usually the rash usually appears within 1 to 5 days after onset of fever. It usually starts from the face and spreads to the other parts of the body, including the hands and feet. So can you go to the next slide? Whenever you come across a case of fever with a rash, we think two things before: measles and chickenpox. Now three things: monkeypox, chickenpox, and it's like a common question how to differentiate between the rashes of chickenpox and monkeypox and the measles. That I say it's two clinical component involved in it. There are some different stages of rashes we should aware of. Then only we can able to differentiate between the rash of chickenpox and the monkeypox. Just by eyeballing, if I want to say, if you find the rashes at one stage in the uniformly in one stage of development, it's most likely to be a monkeypox. Better always confirm with the GP or also the lymphadenopathy. It's a most pathognomic feature in the monkeypox, which cannot be found in chickenpox and measles. When compared to the three, the similarities are three are viruses, but three are different viruses from different families. So that's why they cause us some sorry. I just want to flag only one thing here, the deaths due to the illness. So the monkeypox has relatively higher mortality when compared to the chickenpox and measles. Can we go to the next slide, please? Yes. So usually it transmits from animal to human, which is called as primary infection, and from human to human is called as secondary infection. So the animal to human, it typically occurs in the tropical forest in the Africa, but it's not reported in anywhere else. So for the cases reported outside the Africa, it's mostly of human to human transmission, or they earlier they had a travel history to the Africa. Can you go to the next slide? So the human to human transmission typically occurs in these ways. So direct exposure to the respiratory droplets and direct exposure to the direct contact with the skin material. So the direct contact, I mean, it's unprotected contact. So without gloves, something. And direct exposure to the body fluids such as blood and direct contact with the contaminated materials or sharing the things used by the case of monkeypox. So the virus usually enters through the respiratory tract or the mucous membrane in the eyes, mouth, or even through the broken skin. See, the broken skin is usually followed by a trauma. So in that case, it's there is chance to enter. There's a chance the virus to enter our body. Monkeypox is the disease which has a relatively larger incubation period. Um, so there is one question like how long the case of monkeypox would be contagious. I can say they are contagious between the onset of symptoms until the scabs have fallen off. Once the scabs have fallen off, they are not more like they are not contagious anymore. They can live a normal life like others. Next slide, please. Um, who can get the monkeypox virus? Really? The individuals who had close contact with someone who has the symptoms of monkeypox are most likely can get the diseases. Apart from them, healthcare workers who have been dealing with the case of monkeypox are at higher risks. I can say the next group as the most vulnerable, like newborn children and people with underlying immunodeficiencies, such as uncontrolled diabetes and patients on chemotherapy, are more vulnerable for serious infections, and the infection in them can cause deaths from the monkeypox. There are some evidences that the people who were vaccinated against smallpox are likely to have some protection against monkeypox infection, as they both are from the same family. But unfortunately, the smallpox vaccination stopped in the early 80s. So those who born after 1980s are less likely to get vaccinated against smallpox. It means almost a vast majority of the people are susceptible for monkeypox infection. Next slide, please. Yes. So we will have, let's have some discussion around the commonly asked questions so far. Is monkeypox a new virus? Is the most commonly asked, the most commonly searched term in the Google, you can say. Can you click? Yes, actually it's no. Click again. Um, yes. So actually it was first identified in the colonies of monkeys kept for research in 1958 in the laboratory. So that's why it is termed as monkeypox. Actually, it has nothing to do with monkeys. It is first identified in the monkeys in the lab. So the first human case of monkeypox was reported in the Democratic Republic of Congo, which is a Central African country, in 1970. Between like up to 2013, there were outbreaks of monkeypox in the Central African countries as well as in the Western African countries like Ivory Coast, Nigeria, Congo Republic, Democratic Republic of Congo, etc. And some instances, a few cases were reported outside Africa, for example, in the Europe as well as in the United States of America, Singapore, etc., Iran, etc. But those cases were actually have reported a travel history to the Central African countries. Despite the name, as I said before, the monkeys are not related with the illness. Monkeys are considered as a disease host along with the humans. So, but the specific animal reservoir is still unknown. But there are some evidences says that native African rodents such as some Gambian rats and squirrels are actually may act as a potential reservoir for this infection. Can you go to the next slide? Yes. So I think, sorry, many of us may not see these rats, monkeys, except the humans here. So they are reservoirs for the monkeypox virus. Next slide, please. Is it deadly? Actually, it's not deadly. Can you click twice? Yes, it's not deadly because it's actually a self-limiting disease. Most of us may not require hospitalization, but a very few people may require some hospitalization just because of the immunocompromised status. It has a two clades or two variants: Central African, West African clade. So the Central African clade is somewhat severe, which there were reports saying are up to 10% mortality, whereas the Western African clade it's less severe and it reports 1 to 3% deaths. Fortunately, we have been dealing the outbreak of Western African clade so far. Next slide, please. Yes. Should be worried about the monkeypox pandemic? Actually, no. We should. I will say the reason why we should not worry about the monkeypox pandemic, because it's not a new virus. As I said, we know this virus since 1958, and the human cases are reported since 1970. Actually, monkeypox is very older than me, I can say. So it's not infectious from person to it, it's not very contagious. It's not very infectious from person to person. So the CITREP says 1,552 cases only as on July 8. Just compare the cases of COVID-19 reported so far. So you can just see the COVID-19 cases reported in terms of 100, in terms of 4 digits. But now we have a very less number of cases of monkeypox in the UK. Next, click. Yes, it has a larger incubation period, as I said, 5 to 21 days, which is considered as very large incubation period. We can identify the contacts and we can implement some proactive public health measures like isolation and tracing the contacts and vaccination them. With these measures, we can potentially control the epidemic. Next, click. Yes. It's not like coronavirus and influenza virus. These two viruses are RNA viruses, which has the potential for undergo mutations and causes newer variants. Whereas the monkeypox, it's not a RNA viruses and less likely to find new variants like COVID virus and influenza viruses. Next click, please. Yes. Moreover, we have vaccines. So the smallpox vaccine still is found effective against monkeypox vaccines, but still under under restricted use as per the new guidelines. Next. Yes. So what should I do if I think I might have monkeypox? Next. Yes. So just contact the NHS on 111 or call a sexual health clinic immediately. So your call will be treated as with confidentiality, till you get medical advice, and avoid contact with your friends and families, and isolate yourself till the symptoms, till the scabs fallen off. Next slide, please. Okay. Nice. What is the main difference between monkeypox and smallpox virus? I will say what is the similarity, what are the similarities between monkeypox and smallpox virus. As I said, both are viruses and they both belong to a same family called orthopox virus. Apart from that, the smallpox is highly lethal, which has a high case fatality rate, whereas the monkeypox is a zoonotic diseases and has a very less case fatality rate. So there is another question like, we eradicated smallpox. Can we eradicate a monkeypox in a similar way? Actually, no, we cannot eradicate monkeypox. There are a lot of challenges because, as I said, it's a zoonotic diseases. Still, there may be infection in the tropical forests like uh, monkeys, squirrels, rats, which we are not aware. As it as a animal reservoir, it's less likely to eradicate. We cannot chase all the animals and vaccinate them, so less likely to eradicate monkeypox. Next slide, please. Okay, why is this pandemic is mostly affecting the homosexuals? This is the most common question next to the new virus found in the Google search. So like virus don't care about the sexual orientation. Actually, to be frank, it's a kind of by chance. Anyone comes who come in close contact with the monkeypox case has a chances to get infected. It's like it's a kind of equal opportunity. All the susceptible hosts are have the equal opportunity to get infected. It is not related to any sexual orientation. uh, the gay community is a kind of closed community. I can see it's a kind of potentially super spreading event among the closed group. Next slide, please. Yes. So we have discussed a few questions, frequently asked questions about monkeypox. You can find the most reliable information in the websites of World Health Organization, Public Health Wales, as well as United Kingdom Health Security agencies. They have deal with the myths and facts sections as well. Okay, next slide, please. This is the end of the second session, and we will have a quick poll, and afterwards we will have a question and answer session along with Dr. Giri Shankar here.
Sangeeta, can we have polls, please? I'm not a host there, so Sangeeta, thank you very much, Rupesh. Yes, here it is. We have done polls before the session, and thank you very much, Rupesh. It was very informative. We've got a lot of questions which we're going to bombard you with. I've got few. Meanwhile, we're going to have a poll, all of you. Would you be able to answer these questions? Thank you, Geeta. Select the organization from the list which publishes reliable health information. The second one is monkeypox a new virus? Will you check the facts before sharing any health-related information? Thank you. Have you received? No, not yet. 1 of 7. So please answer, all of you. That will be great. 2. That's good. 3. 4, which is good. I think Rupesh, myself, and Sangeeta can't do it. So everyone has done it, I think, if I'm not mistaken. So that's up to you. Is there anybody left out to answer? Somebody's doing it, so I'll give it. Anybody still doing it? Answered? I can see Geeta smiling away. That's good. So yes, we've got some answers here. Rupesh, you can have a look at it. Shall we stop?
Yeah, thanks. Nice responses. Yeah, good. So the reason for this poll is like just to reiterate the information and sharing this some kind of take-home messages. So the only take-home message I would like to share is whatever the information you come across, just do fact check and don't trust it blindly. So uh, it's not about sharing with others. First we should be able to say whether it's true or not. So by not sharing the false information, actually we can indirectly save the life of a group of people.
Shall we start questions now, or
Yes, I'm happy to
yeah, is
answer the
that okay?
questions. Yeah.
You asked about who do we trust and who do we contact, like WHO, Public Health Wales. Not just about monkeypox, but in general, we had problems with COVID-19, and there were so many different messages across within the UK. Like Public Health England had a different kind of strategy or information on COVID compared to Wales. So, do you have any answer to that?
Thanks for the question. Actually, it's a very good question, but I invite Dr. Giri to answer because I was not a part of UK when this incident happened. So I am relatively new, and Giri have the better experience of answering this question. Giri, they would like to ask about the approach of Public Health England and Public Health Wales.
Thanks, Rupesh. That was a nice pass. Thank you for that.
It's a wise
I
pass.
think it's an important question, but it's important also to recognize that the epidemiology of COVID was not uniform across all the 4 nations of UK. And indeed, it wasn't uniform across all Wales even. We experienced different rates of COVID in different parts of Wales even. In the first wave, for example, cases started to accumulate first in the eastern part of Southeast Wales, then started to spread more towards the west and then north, etc. So in various waves, the epidemiology was different. Therefore, the respective governments, when they designed their control strategy, had to be responsive to the epidemiology at that time. And that largely dictated the risk communication strategies. However, what was the virus, how it behaves, how it spreads, what is the vaccine, how effective it is, what are the precautions to take, they are all relatively common messages, whether you are in England, whether you are in Wales or any part of the world. Therefore, I'd like to think that as far as those messages are concerned, they remain consistent and aligned pretty much, but what interventions to be introduced in which part of the country at what stage was largely dictated by the epidemiology and also the political considerations in those governments.
Thank you very much. On that note, the mentoring had done Infodemic on COVID in February. We've got the YouTube. So what we did was we have invited a virologist from America, because that was very new. Nobody was giving us any information. So he has given us the importance of vaccination. And we've been part of the community to encourage people to go for vaccination because they were intimidated, why vaccination for COVID. Anyway, any more questions? Because I've got a few questions. I don't want to take over. Anybody would like to ask
Yes,
any
Sujata,
questions?
I would like to add one point along with Dr. Girish. So it's not only in the UK, it was a scenario in the other parts of the world as well. So I was a part of this incident in India that time. Even we were dependent on the evolving evidences from the various resources. So as Dr. Harry said, as we were dependent on the evolving evidences, our strategies were frequently catered as per the needs at that moment. So we never it's a kind of bad thing. We are not ready. I mean, we don't want to face another pandemic. That's what I can say.
you. Thank you both for answering. Any more questions? Can I ask one more? See, during the presentation, Rupesh, you talked about monkeypox having a lymphodenopathy. It's a bit of a jargon for us because I'm not into medical background. So would you be able to tell us about it?
So the lymphadenopathy means enlargement of lymph nodes. Lymph nodes, I can say, lymph nodes is usually it's not enlarged. It's found all over the body. Whenever there is infection in a particular place, for example, if I have a sinus infection or an air infection, so the lymph nodes around the face, especially here below, will be enlarged. So that's called as lymphadenopathy. So the enlargement of lymph glands is lymphadenopathy. Generally, if in a normal human being, the lymph nodes are not swollen. So if there is some swelling in the lymph nodes, it means some infection is going on. It's a kind of sign. Thank you.
Thank you. Any more questions you have? Let me ask you another question then. Sorry, somebody is here?
Yes.
Yeah, somebody has got a question. Welcome, Abbas. Do you have any questions on monkeypox? We're just
You
going
can
to
unmute and ask. I think he's on mute.
You have to
can
unmute
and-
Abbas.
Hi, I just arrived. Hi everyone. I just arrived, and if there any chance to give me a quick notes about how many money books we have issue in Wills at the moment.
Sorry, how many?
How many case is any how many case we have for the money
In Wales, you mean? In Wales?
In Wales, yeah, in Wales.
Okay, one second. I'll just share the screen.
Yeah.
So
we have
as per the last CITREP, we have 18 cases of
18.
monkeypox in the Wales. 18 cases of monkeypox in the Wales, as per the last CITREP.
Right.
Is it the
So,
one? I don't know. I just saw it, but
yeah, 18.
Yes,
18.
you can just scroll. You can
Yeah.
just scroll some more slides.
Right.
Yes,
yeah,
the next
this is the
slide.
one.
Yeah, the next slide. Yeah,
Uh-huh.
18
Can you see that,
cases.
Abbas?
Yes, I see. 18, yes, plus 3, yeah. So please, if you don't mind, if you can send this to us, please, by email, the slide. Yeah?
Yes,
It is
about
on
slide.
the Public Health Wales.
Yes,
Public,
Send it.
no, all the slides for the today, yeah. So,
yes. Public Health Wales publishes a weekly epidemiological report about monkeypox, so you can just follow. It's
Mhm.
available
will
in the
take-
official Public Health Wales website.
Yeah. It is available on the website. That's what
Yeah,
Rupesh is saying.
no, I mean, Zagatha, if there any chance to send to me the slides for today.
For today's, is it? It will be
Yeah,
on the
because-
show. We've got a YouTube channel. You can have a look at that, but I'll ask their permission before I share the slides, if that's okay. Abbas, thank you for asking.
Thank you.
Is there any burning questions that you have on monkeypox, please? Because they're here, Dr. Girishankar and Rupesh. I've got one more question. You have highlighted, Dr. Rupesh, that mostly male, you said male and gay. And so is it something that is affecting mostly male? This data doesn't say anything about the gender.
As I said, the cases were reported. The cases are reported among the gay community predominantly. Doesn't mean that all those affected were gays. So the higher proportion in the among the homosexuals. So as I said earlier, monkeypox transmit through the direct sexual contact. Direct contact. That doesn't mean be sexual always. Direct contact. So as they are close group, the how can I say? I got a question like why it is higher among the homosexuals? Is that your question, or?
No, in the data, in the presentation, you said it's mostly through, I don't know which slide was that. So do you want to say something, Dr. Girish?
Can I respond
Yes,
to that?
Giri, yes, Giri, please. Yeah.
Yeah, I think it's just the way the infection has got introduced into the UK population is that it hasn't uniformly affected all population groups. It has started off with one subpopulation of our wider population, and that subpopulation is abbreviated as GBMSM, gay, bisexual, and other men who have sex with men. The reason it is spreading in that subpopulation is because it is a very close, dense sexual network, and a lot of people have frequent and also anonymous contacts with new partners that they meet online. Therefore, at the moment, that is where we are experiencing, and that's what we're seeing. The concern still remains that because there is a bisexual population involved, there may be risk of transmission to heterosexual populations, such as the females and children. So far, we haven't seen, as Rupesh's data suggests, in excess of 99% of the cases have been in that subpopulation. So we should try and contain that infection within that subpopulation, and therefore raising the awareness, the importance of getting vaccination all becomes really important going forward.
Thank you. So is there any monkeypox vaccination soon?
It has already been commenced, as Rupesh mentioned in his presentation. The smallpox vaccine, a third generation derivative of smallpox vaccine, has shown to be highly effective in controlling monkeypox. And at the moment, that is what is being used to do two things. One, to vaccinate people who have not yet got the infection, so that it acts as a prevention for them before they actually get meet the virus. And secondly, you can also do it after somebody has been exposed, but the window of opportunity is very limited. It has to be done within the first 4 days to be most effective. So in technical terms, we call it pre-exposure prophylaxis and post-exposure prophylaxis.
Thank you. Thank you very much. Any more questions that you all have? Please ask now, because they're here one-to-one. You don't have to go to a GP. You can ask all your concerns here. You don't have to wait. They're here to give you first-hand information. No more questions? Hazel, you have anything? You have to unmute yourself.
Not really. I understand what it is, monkeypox, but I'm not aware what's out there. There's so much goes on in the news and the social. You're just not aware of things, truly. I recognise obviously smallpox and all those chickenpox. We had them when I was a child, so we had our injections. So it's just this time of life, isn't it, right? Because people travel more. So we have to embrace more viruses. That's what it is.
I think it's a good observation. We talk often about emerging infections and re-emerging infections. And when we talk about emerging infections, it's about emerging in new population groups that it had previously not been seen, and also in new geographical areas where it had not been previously seen. And as you rightly point out, travel, amongst many other factors, is an important consideration. With people, when people move, the bugs move with people. Therefore, this is not the only example of that. And we've got numerous such examples when that has resulted in infections emerging in newer geographies. For example, in UK, the monkeypox.
Well, what I found is to get into countries now, you've got to have this jab, have that vaccination, which there were normal things you automatically have because we don't have it in this area. So when I traveled, my last time I traveled, I took the COVID, and I had to do that before I even leave my home, and I had that sheet so I could just get in the airport and get on the plane. And when I got the other end, they've never seen anything like that. They were fascinated. They don't realize how bad it is here, or has been here. So I said, and my attitude, is this the new flu? We're used to the flu, because the flu can kill as well. If not taken care of, yeah.
No, you're absolutely right. I think COVID has shown us that over the last 2.5 years, lots of bizarre behavior by communities, people's reaction to the virus, people's reaction to the different phases of the pandemic have been different. And it also, the experience of different countries in the world has been different. Some countries have been badly affected. Some have been lucky enough to be less badly affected. But I think it's fair to say that almost every country has experienced. And we know that before the vaccine was rolled out, and we know how beneficial it has been. You will remember in the early days of 2020, there have been significant excess deaths. And some of the extreme measures that had to be put in, including lockdowns, asking people with underlying medical conditions to be extra cautious, all seems proportionate at the time. Therefore, when you travel on a plane with a visor on and with lots of masks, gowns, etc., it just looks odd because we've never used to living in those ways in our society for hundreds of years. But here was a virus that was just ripping through the population, and we needed to have an extraordinary response for an extraordinary virus.
Yes, thank you very much, Dr. Girish and Dr. Rupesh, for enlightening us about monkeypox and what precautions we should take. It was really informative because we didn't know a lot of things, and we will spread it across. We're going to send you the YouTube link as well, so you can have a look. And if there is anything more, we will contact you again. Thank you very much for your time. We really appreciate. Goodbye.
Thank you.
Thank you.